Yes, ma'am.
Right. So if you've read and understood considering it critical care scenario, please tell me how would you manage this patient?
I would like to manage this patient according to the Ccrisp protocol.
Yes. Critically ill patients. Yes. Protocol. Yes.
With the critically ill patient,
Yes.
and I would like to manage this patient according to ABCDE approach.
Right. Yes.
Along with this, along with this, I will connect with a few medical professionals. Like
Later. ABC protocol. Please begin with A.
I will take care for her airways.
Yes.
If compromised, I would like to put oropharyngeal airways. If I would first of all I would call for help.
By help. You are there.
If the patient is unstable, I will ask I would like to ask the name of the patient. If the patient is speaking,
Okay.
that means patient the airway is patent. If
Yes.
the patient is speaking, I would like to check any foreign body inside the oral cavity, and after
Yes.
that I will
You
secure the
you'll
airways.
remove it if there is any foreign part body. Yes.
Then I will secure the airways by passing oropharyngeal airways.
Good.
Meanwhile, I will keep an eye for her oxygen levels.
Okay. Right. There are certain labs which are shown in front of you. How would you please comment on them?
The potassium, as the potassium levels is potassium and chloride levels are low, and pH is in on alkalosis level.
Yes.
This here is demonstrating hypokalemic, hypochloremic metabolic alkalosis.
Yes. What measures would you do to correct patients' arterial blood gases or patients' labs or patient's situation? Because here
I,
patient is confused, fatigued, and everything.
I would like to give this patient intravenous fluids.
How
I will
much?
I will give normal saline along with potassium and chloride supplementation,
Okay. Why normal saline?
because this fluid contains sodium as well as chloride ions.
All right. Okay. How much is the potassium and sodium and chloride normal saline containing?
Sodium is around one
If you can't
115.
remember, then we can discuss at the end.
Yes,
Doesn't
ma'am.
matter. Okay. Please tell me what might have been the cause behind patient's this condition. What
There
would
could
be the provisional diagnosis you would consider?
The provisional diagnosis for this patient is gastric outlet obstruction
Yes.
and can be due to benign or a malignant cause. The benign cause can be chronic gastric ulceration, which
Yes.
can
Perforate.
lead to,
Yes.
pyloric stenosis,
Mm-hmm.
and the malignant cause can be pancreatic or gastric carcinoma.
Okay. And there could even be a congenital cause, duodenal webs. Okay. Okay. Right. Would you be able to classify hyponatremia? What are the different types of hyponatremia that can occur?
Hyponatremia can be iso isotonic, hypotonic, or hypertonic. Isotonic isotonic can be due to hyperlipidemia or hyperproteinemia, and hypertonic can be due to hyperglycemia or mannitol or sorbitol.
Okay, what are the complications that can occur or result because of hyponatremia?
Uh, First of all, the hypernatremia gives CNS symptoms like confusion, agitation, and fits. Along with it can also cause cardiac failure or renal failure.
Right? Yes, how can this be corrected?
Hyponatremia can be corrected with intravenous fluids,
And
like isotonic fluids or hypertonic
is there
saline.
anything else you'll give to this particular patient for any of these labs that are in front of you? Why would you, or when would you give bicarbonate to the patient or anything? What would you give? Like, I want to know, I want you to tell me what specific management you will give to this patient. If your conservative management that you're offering is not working, what would be your next step?
I would like to give hypertonic saline,
Yes.
but uh, but this should be given very slowly because it can lead to uh, deep. It can cause demyelination of CNS. And I forgot. I'm sorry. I forgot this
That's all
enzyme.
right. We'll focus. We'll think. Okay. How much should be the normal potassium level?
Normal potassium levels are from 3.5 to 4.5.
So here, because of vomiting and all that, it's low, right? Could there be any possibility you can correct potassium level of this patient, because this low potassium can result into certain complications like arrhythmias or cardiac events? Or so is there any possibility if you have to give potassium as a supplement, how would you give? Is there any way you can
Yes, I would like to add.
administer? Yes.
I would like to administer uh, this iron, this supplement into the intravenous fluids.
Like, which fluid would you choose then?
With the normal saline and along with I would add potassium in the normal saline.
Okay. Right. What are you have told me the pathogenesis? Right. With this patient, what are the other complications that you should watch out for? Could there be anything that you should be really careful about?
Yes, I would like to monitor the cardiac status. I would like to monitor the heart status
And
and the output of this patient. For this, moreover, uh,
output only, input, output.
I will also input and output. I will
Yes,
also pass
charting. Yes,
NG tube and
yes,
catheter.
yes. All right. Thank you.
Thank you.